I remember in February of 2020, maybe it was early March, I was asked to be the peer reviewer on a research paper from China that was showing people staying positive on PCR for 80 days.
Wow.
And that's actually what led the CDC originally to say, look, if you're positive with COVID, don't use a PCR test again for 3 months because you might keep being positive from the same old infection, even though you're no longer infectious. So there has, for the entire duration of this pandemic, this has been known. Unfortunately, we've had a miscommunication between what we knew, and the CDC was saying, don't use a PCR test. They're not specific to the infectious period. But then, unfortunately, there was a lot of misinformation and miscommunication and misunderstanding about when we use a PCR test as the gold standard for a test meant to detect the transmissible window. A lot of people say, oh, these tests for the transmissible window are not sensitive enough. But it's not that they weren't sensitive enough to detect that. It was that the PCR was not specific enough to only be positive in that period of time we care about. And it has led to massive confusion on a global level, literally across the globe, about, well, are antigen tests good enough for what we need them for? And I would argue absolutely, they certainly are.